the fellowship options where you can consider, and these are long-term options. Say, suppose they are year to 2 years long also. And the next question is, how are the job opportunities? So, be it in a hospital, hospice, NGO. So, in a hospital, you have definitely a lot of options in a tier 1 city and plenty in tier 2 as well, because tier 2 is also expanding. So right now, even if you want to take up a city of your choice, there are high chances that you can land up into a senior residency there. Say suppose you want to get into a teaching institute, academic institute, institutes like AIMS and Tata, you have to work for 3 years as an SR before getting into an assistant professor role. And the same is applicable for every other branch at these central institutes. If you want to join in a statewide college also, there are plenty of opportunities because currently there is no saturation. There are other options like where you can go ahead and take up a hospice role, and that is also available option. Or you want to go ahead and start up your own private, freelance consultations, or start up your own home care teams. These are different options where if you want to go and join in a geriatric unit or a long-term units. These are beautiful options that are available. The next question would be, what are the income aspects after MD or DNB? How much you get monthly? So depending upon the institute that you're working, during the residency, the pay is around 60,000 to 1 lakh. If you're in a central institute, the pay is a little more higher. If you're in senior residency, it is around 80,000-90,000 till 1.2, 1.3. If you get into an assistant professor level, depending upon which state you are, it is on par with any of your state government colleagues that are into the medical practice. And then the realistic salary variations, definitely if you want to go ahead and freelance work, want to go for a home care visit, earning potential is there provided you are willing to work out of your work hours and then go ahead. Or else if you are very much happy with whatever you're earning in your academic professional career in your hospital, that should be good enough. And then will there be saturation with experience compared to other branches where you require a lot of skill, like say surgical practice, you need a lot of skill? This one is relatively much easier on that way, because if you are someone who is looking for a stable career, I think this is something that you can consider, because this is basically an N branch. So you want to do any particular fellowship, that is up to your own interest. And next question is, how is the work-life balance after PG? So residency is definitely hectic, but post your PG, the life is very much easier. You have a good work-life balance, and depending on the institute, you have around 9 to 4, 9 to 5 or 6, and you have academic work as well, no doubt. And the responsibilities are at a different level when you get into the senior roles compared to in your residency. Compared to residency, life after PG is much more balanced. Calls are very much lighter, emergencies are much fewer, and you have more structured work hours, and this will give you a lot of space for your family, hobbies, and also personal growth. So I would like to close this by saying that palliative medicine, it is not just a career, it is like a calling. Yes, this definitely has challenges, but the growth and opportunities definitely are there, and human connections are something that are very deeply rewarding. So if you want me to deep dive on any other things, please do let me know in the comment section below. And do you suggest I take this branch is another question that I get. So it is not like I suggest someone, because whatever I've told is a personal opinion. So depending upon the priorities, where you want to settle further, the kind of a lifestyle or work-life balance that you want, that is how you choose a branch. Because even though you tend to see like a few patients, those few patients occupy your entire day, because success here is not measured by how many days the patient is living, but how many meaningful days that you're adding to patient's life, patient and the family. So it's like a holistic management. Apart from an emotional weigh down, that is like the biggest con I would consider, I think this branch is personally very rewarding, and I would not regret taking this branch. Even if I were given another choice, go back and choose a branch, I think this I would choose, because I find a lot of personal gratification and satisfaction doing this. Earning is also there. It is not very huge like your super specialist who is earning, but if you're someone who is considering for relatively a stable earning and a good work-life balance, personal growth, this definitely is good. So once you get into a senior role, you will not be doing the basic, more of human contact or more of a counseling that is usually done on the ground level as a resident. So in that way, life gets much more easier when you get into the senior levels, and your kind of a perspective on how you view a person as a whole also differs. It kind of like changes you, because I was like a type A hyperactive person, but now I find myself very much calm, relaxed, and composed. So that is how a branch will always shape. You are trained in advanced communication skills, advanced pain management, refractory symptom management, and a lot of serious illness conversations, trying to deal with the death, dying, and bereavement. All of this will definitely change you, but it gets easier and better once you get into senior roles, because you have a lot of research, academic activity, and palliative is still an emerging specialty. There is so much for you to contribute as an individual. So I'm not imposing that someone should take this branch, but if this is something that is actually interesting you, this is like a full-blown clinical branch and you can consider it as your option. So I would suggest you going to any of your closer by cancer center that is actually offering palliative. Talk to the resident there, see and understand how the workflow is going in the department, and then you should choose this branch. Because since we have not been exposed previously, we are very much naive. So you shouldn't get into something that you don't know. So please go expose yourself and see if this branch is suiting for you for the rest of your life. That's all I would like to say. If you have any comments, please drop them below and feel free to ask. Thank you.